title, please.
Sure. I'm Suzanne Beur. I am Associate Professor of Medicine at Johns Hopkins University School of Medicine, and I'm also the President-elect of the American Society of Bone and Mineral Research.
Well, welcome. I appreciate your time today. This is Overdrive, the Rheumatology Network podcast. And today we're focusing on osteoporosis. And there is a lot of evidence, scientific evidence that's published on a regular basis, and probably a lot of conflicting information. So what we wanted to do today was discuss best practices for physicians who treat patients with rheumatic disease, and whether or not they should be taking vitamin D, how much and in what form. Should it be sun? Should it be a supplement? So those are some of the things, that we're going to be talking about today. So let's talk osteoporosis. How important is it to continue taking or reach a healthy level of vitamin D?
Yeah, so we know that vitamin D is important for a number of bodily functions. It's really important for skeletal health. It's important for skeletal mineralization. And a lot of times the only way we get vitamin D and the main way we make vitamin D is through exposure of our skin to sunlight. So in the situation where we are at stay-at-home orders or maybe not getting out as much as we usually do, people are going to get less exposure to their skin and be making less vitamin D. There are very few dietary sources of vitamin D, and many of the dietary sources of vitamin D are not that palatable, such as fatty fishes and fish oils, and they generally contain not a lot of vitamin D. There are supplemented foods like our dairy products in the U.S. that do have some small amount of vitamin D supplementation, but again, it's a lot less than the daily recommended amount of vitamin D. So if people aren't getting sun exposure, or if they're covering up, or if they're wearing sunscreen because they're trying to reduce their risk of skin cancers or reduce signs of aging, really they're not getting vitamin D through skin synthesis through sun exposure. And dietary amounts are usually low and they're inconsistent, and supplemented dietary amounts are low. Generally, we recommend vitamin D supplementation because then you know how much you're getting, you can do it on a consistent basis, and you're not required to have your skin exposed to the sun.
Which is a good thing for patients with rheumatic disease who may be at higher risk of melanoma and other skin conditions.
Yeah, and can have sun sensitivities that can cause certain rashes and flare up of their disorder. So that's exactly right.
I see. And recently, the American Society for Bone and Mineral Research, of which you are the current chair, is that correct? Has issued
President-elect, yes.
President-elect has just issued a joint guidance on vitamin D in conjunction with the European Calcified Tissue Society, the Endocrine Society, the American Association of Clinical Oncologists, and the National Osteoporosis Foundation, including the International Osteoporosis Foundation. That's a lot, but these are some pretty heavy hitters when it comes to guidance on osteoporosis. So tell me, what are they recommending in terms of vitamin D guidance in the era of COVID-19?
Yeah, so it's a joint statement with 7 different societies, including an international society. So a lot of expertise and expert opinion went into issuing this guidance. And I think the way that it came about was that there are some initial publications that showed that those with lower vitamin D levels in their blood had poorer outcomes with COVID infections. So the guidance is for 2 reasons. One, to encourage people to be vitamin D sufficient and to make sure they're getting vitamin D. But 2, also to put that data in perspective as far as expectations for what vitamin D can do with respect to COVID. So for the first part, it's very important that we are focusing a lot on COVID, and COVID is keeping a lot of people from getting their regular medical care. So one of the things we want to make sure is that people maintain their regular medical care and their regular medical routines. So for people with osteoporosis or skeletal health issues, it's really important to be able to continue to get your calcium and vitamin D. And many of us are not getting outside as much because we're staying indoors because our normal activities have been curtailed. So for those who are not getting their vitamin D through sun exposure, we recommend supplementation. And the Institute of Medicine recommends between 400 IU of vitamin D to 1,000 IU of vitamin D daily. Other experts might recommend that you achieve a certain serum level of vitamin D to have the skeletal benefits of vitamin D. Mm-hmm. So this statement says, consistent with the IOF recommendations, 400 units to 1,000 units of vitamin D supplement per day for those who are not getting at least 15 to 30 minutes of sun exposure without sunscreen on their skin.
So it's either or, it's not both then, either sun or supplement.
Yeah, in the summer months, generally between March and November, the sun rays are strong enough to be able to produce vitamin D through sun exposure. Mm-hmm. From November through March in the winter months, the sunlight exposure is the UV potency is less, and you make less vitamin D when you're out in the sun. But certainly during this time, being between 15 and 30 minutes on skin that's not covered and doesn't have sunscreen on it is a good way to get enough vitamin D.
Mm-hmm. I see. And what are the target serum levels?
Yeah, again, this is very controversial, but generally we think about 30 nanogram per ml is where 30 nanogram per deciliter is where we start to see the skeletal benefits. Mm-hmm. So generally, that level of vitamin D exposure mm-hmm. from the sun or through supplementation can get you to that level. Mm-hmm. Although people that are older, people with darker pigmented skin may require more exposure to make the same amount of vitamin D. In the situation with older individuals, their skin is less efficient at making the vitamin D. In individuals with higher pigmented levels in their skin, their skin is also makes less vitamin D per UV exposure.
Well, I didn't know that. So all the more reason to see your doctor to get an appropriate prescription so that you know how much.
Yeah, so you can measure your levels and you can make sure that you're taking enough.
Mm-hmm. Yeah. Right. And what did the team say about calcium? What are the recommendations for calcium then?
Well, this guidance really didn't lay out the calcium recommendations, but consistent with the Institute of Medicine, generally we think that people should get 1,000 milligrams of calcium a day, and that should be taking into account their dietary calcium and then adding on top of that the supplements. I think what happens is sometimes people just get advice, take 1,000 mm-hmm. milligrams of calcium a day, and it's not taken into account that they get calcium in their diet. Things like dairy products are rich in calcium. Mm-hmm. Almond milk is rich in calcium. Mm-hmm. So there's dietary sources of calcium, and many people get quite a lot in their diet and may not need any supplementation or just a tiny fraction of that. So I don't want to be misunderstood that it's 1,000 milligrams of supplements a day. It's 1,000 milligrams of total calcium intake, and taking dietary into account and then just making up the difference with the supplement.
Right. So it requires some real careful watch of your diet. If you're eating calcium fortified cereal, for example, that counts. So write it down. I like to write it down so I know exactly how much I'm getting every day. But it is a challenge to keep vitamin D up. I myself am at 14, and that's very low.
Yeah.
And And
so for the calcium piece, yes, you should be looking at your cereal, look at your orange juice, look at your almond milk, look at your milk, look at your yogurt. I'll give you one quick tip. It usually is expressed in percent of daily, mm-hmm. and that is out of 1,000 milligrams. So if you just put a 0 on the end of the percent daily, that's the number of milligrams, and that mm-hmm. helps you figure out the total.
Right. Okay.
Yeah. And with respect to vitamin D, yes, it's surprising how many people do have low vitamin D levels. Um,
Right.
and sometimes you don't know it unless you measure it, because
Right.
we really get less sun exposure a day than we really think. And many of us in our moisturizers, in our body creams, whatnot, have SPF um, sunblock in there, and that basically completely mitigates the ability of that UV ray to penetrate the skin, which it's supposed to do, but that then keeps the first step of the vitamin D synthesis from happening.
Well, there's so much to consider. I had no idea. The doctors never pointed that out. Wrote the SPF on.
Yeah.
Oh my goodness. Um, I wonder, is your concern once COVID-19 subsides, say it's December, and patients are a little more comfortable, they're going outside, they're meeting with their doctors, that you'll begin to see some maybe negative outcomes as a result of not keeping up with vitamin D supplementation? Is that a concern? Because I myself, I just haven't had time to go and buy more vitamin D.
Yeah, no,
Uh,
absolutely. I mean, I think that, if people have kind of not been able to keep up their normal medical regimen,
right.
it might be worthwhile, meeting with their physicians, getting back on their medical regimen, and then getting their levels measured, or, to see where they're at and to make sure that they're getting enough vitamin D. I mean, it's very important with some osteoporosis medications. Now, I know we're kind of going beyond what the the statement released. Some osteoporosis medications, it's really important that your vitamin D is sufficient, because they can cause some transient dip in your blood calcium levels. So, for example, denosumab, zoledronic acid, these are really important that people are vitamin D sufficient. So if they're having ongoing treatment with those osteoporosis medications, which I sure hope they are, if they're being prescribed that, it's really important that their vitamin D is sufficient and that they're staying on top of that. And in many instances, we measure people's vitamin D before we administer these treatments, because we don't want to precipitate a more prolonged dip in people's calcium levels. So if people are undergoing treatment for osteoporosis, they really need to make sure that they're keeping up with their vitamin D regimen, and they probably should get their levels measured before they, if they went off their regimen, levels measured before they continue to get their osteoporosis treatment. But it's important to get those osteoporosis treatments on time, especially with denosumab, because you can lose bone if you don't get them on time.
Mm-hmm. Okay, well, thank you. Do you have any other parting words for our listeners today?
Yeah, so I did want to say one other effect of vitamin D, other than with the skeleton, is it's important in immune function. And there's been a number of studies demonstrating its positive effect on the immune system. So I think that we as a society are saying that it's really important that we have continued research in this area of vitamin D sufficiency and vitamin D, and how that may impact your risk of infection with COVID and your outcomes with COVID, because it very well may have some effect on your immune system. We just think the existing evidence is not strong enough to make any conclusions, but we do support further research to see if there will be any positive impact of vitamin D on the actual effects of the COVID infection or COVID outcomes.
Well, thank you. We look forward to seeing more research and more work on this. This has been interesting. Yeah, so hopefully we'll connect again in a few months, and maybe around the time of ACR if there are new reports, and we'll talk again.
Yeah,
Okay.
I'd love that. I'd love that. Thank
Okay.
you very much.
Well,